Well, my resolution for 2021 was to make more YouTube videos. However, this is not one of the videos that I had intended on making. However, as you've read in the title, I've had some health issues going on over the past couple of months, and I just wanted to share that with you, kind of tell you a little bit about my journey, what I'm going through, and also kind of encourage you to take some action, for your health to hopefully prevent some things down the road or to catch some things early, and just take care of yourself. So I want to start by telling you, first of all, I know you've read the title and you know what's going on, but things are not as bad as they seem. Okay, I've got a positive attitude. I feel good. My doctors are optimistic. I know when you see the C word, you hear somebody say they have cancer, the first thing that comes to mind is that, oh my gosh, how long do they have to live? Is Zan going to die in 6 months? Is Zan going to die in 3 years? What's the deal? What's going on? But number one, first thing I want to say is it's not as bad as it sounds, okay? Now, no, there are probably no good so-called types of cancer, but if I had to choose a type of blood disorder or blood cancer, this is probably the best one that you could ask for. And I say that lightly because I know there's other people who are probably going through a very similar path than me, and there are some people who have had a lot worse times than I've had so far, or I may have. So I don't mean to discount that. I don't mean to say that it's no big deal and it's fine if you have it, because I know there are people who have PV, what I have, and have had major life-altering changes. For me, nothing has gone terribly wrong yet. Okay, so I want to say that first. And then I want to start by telling you kind of my story and kind of what happened. So bear with me. I'm going to try to make this as short and condensed as possible. But I appreciate you watching. And I think it's just valuable for you to know how I found out, what the path is moving forward, and then maybe what you can do for me or for yourself. So number one, every year I go to the doctor, typically in January, and I have an annual physical, just an annual checkup. I speak with my doctor, I get prescriptions refilled, we do a blood work, a blood panel, make sure everything's okay. This year was a little bit different. I've been doing this for the past number of years, and this January I went and saw my primary care physician. We did the blood work. A few days later, she called me back and said, "Hey, Zan, something does not look right on your blood panel. Your iron levels are really high. Your hematocrit, which is a red blood cell value, is really high. I'd like to send you to a specialist. I want to send you to a hematologist to do more testing." She had a thought that it might be hereditary hemochromatosis, but she needed to send me to the hematologist to find out. At the time, I didn't understand that a hematologist was an oncologist, and that I was going to see a doctor that could possibly be treating me for a type of cancer. Something you all learn as you're going through this process, I guess. So I scheduled an appointment with the hematologist. He tells me it could be hereditary hemochromatosis. I'm not sure. There are a few other blood tests we're going to do. We're going to test for a couple of things in your blood, and we're also going to possibly test for something that could be going on with your bone marrow. So we did those tests. They took up to about, I think it was a week and a half or 2 weeks to get the full results back. So I was fairly nervous during that time, but I thought everything was going to be perfectly fine. The first test that came back said negative for hereditary hemochromatosis. So I'm out of the clear. Everything's good. Then probably 3 or 4 or 5 days later, I got my other results back, and it said, "You've tested positive for a genetic mutation, JAK2, and there were some other letters and numbers behind it. I've forgotten. I think it's V169F. So I forget exactly, but I tested positive for some genetic mutation. So the first thing I do is I start to Google it and see what's going on. And as you'll find out, and I would share with you, Google does not always have the best answers for somebody going through any sort of medical disorder. But a few days later, I had my follow-up checkup with him, and that's when he confirmed my suspicion that I have something known as Polycythemia Vera. It's known as PV for short. What PV is your bone marrow, from what I understand, and I'm learning this. I've been doing a lot of research over the past few months, but I'm not an expert by any means. But your bone marrow acts like a thermostat where it regulates your red blood cells. So if you have too many red blood cells, it's going to, slow down production. If you need more, it ramps up production. Again, just like a thermostat where you put on your wall. If it gets too hot, the air conditioner cuts on. If it gets too cold, it turns off. All right. So what my body does is it just doesn't ever stop producing red blood cells. And the more red blood cells you have, the thicker your blood gets, which puts you at a higher risk for a few different things to happen. You're at a higher risk for a heart attack. You're at a higher risk for a stroke. You have poorer circulation. Again, you can just imagine how normal blood flows through your body. When it's much thicker, your heart has to work harder to pump it. Your red blood cells are what carry the oxygen throughout your body. So your body is not getting oxygen as efficiently or transporting oxygen as efficiently as someone, with a normal red blood cell count. So the main way that we combat this and we fight this is there's no medicine I'm on, nothing like that. And again, like I said earlier, I'm not on chemotherapy. I'm expected to live a long life. Everything we think is good and moving in the right direction. But how we combat this is it's simple. I take a baby aspirin every day. And right now I'm going for very regular phlebotomies. Phlebotomy is basically where you give blood, but instead of donating it to someone else in need of it, they basically just take it out of your system and maybe throw it away, for lack of a scientific term. But they just get it out to try to thin your blood, which does two things. It lowers my hematocrit level, and we're trying to get that to a very manageable level. And also it helps get the excess iron out of my system. The iron can potentially cause issues down the road. You don't want a lot of iron being dumped into your liver or dumped into your kidneys, into the filtration system. So we're trying to thin my blood with regular phlebotomies. I've been going through the phlebotomies right now weekly for the first 2 months or so. They're expected to continue weekly for the next probably 4 or 5 months if I had to guess. Again, my numbers are improving and my doctor's optimistic, but I'll probably have to always do a phlebotomy on some regularity. Hopefully it slows down. If the numbers continuing to improve, at some point in the future, I'd like to do a phlebotomy once every 2 weeks and then maybe once a month. And then if things go really well, maybe it would be less often than that. So that's where I tell you I know you're watching this video. If you've already watched it this far, I appreciate your concern. I appreciate you, caring and listening and wanting to know what's going on with me. It's not as bad as it sounds. Again, not that you want any form of cancer, but if you had to choose one, this is the one to have. It's not leukemia. I don't have an immunity disorder. I'm expected to live a long time. I've joined a number of Facebook groups, support groups, forums. And the one thing that most everybody says is whatever you do, don't go to Google for information. Okay. Which is kind of hard because some of you are watching this and I know the first thing you're going to do is Google PV or Polycythemia Vera. One of the first things that pops up is, and it's the first thing my mom saw when I told her, it says life expectancy 2 to 3 years. I just want to confirm with you right now, I do not have a life expectancy of 2 to 3 years. There are many, many people in these Facebook groups who have lived 20 and 30 years with the exact same thing going on that I have. I'm still fairly young. I'm fairly healthy. So that's a good thing. I'm also grateful for something else. Again, I'm grateful it's not a much worse disorder or a much worse form of cancer, but I'm grateful that we caught it early and that I'm healthy. One of the things that I found out, most people find out they have PV because they've had a previous traumatic event. Maybe they have a heart attack or they have a stroke. They're admitted to the hospital, and then the doctors find out and they say, oh yeah, look at this. This is why you had a stroke, or this is why you had a heart attack. Luckily for me, I just went for a routine blood test. My primary care physician did a phenomenal job, recognized something was off, sent me to a specialist, and we're taking care of it early. So I'm 39 years old right now. So I got it a little bit younger than most people do, or most people caught it. But again, I'm in good health. I can continue to work out. I'm going to continue to eat healthy, all that sort of stuff. Which kind of brings me to my next point. And probably the most important point of this video, to be honest. I've kind of debated going back and forth. Do I want to make this video or do I want to keep it private? A big part of me just wants to keep it private. Okay. I know I have a fairly large following in the baseball world. I'm sure after a lot of people see this, they're going to want to reach out to me. They're going to want to email me, call me, text me, and message me, leave a comment. I promise you it's unnecessary. And just being perfectly blunt, it's kind of unwanted. I don't want to receive 600 emails from people saying they're thinking about me and they're praying for me. While that's very appreciated, I don't want the burden of having to reply to 600 or 1,000 or more people or whatever it is. I kind of just want to continue about my day. And that's why I had to struggle, should I make this video or not? It would be very easy to keep it to myself, manage it, continue to improve, and live a hopefully fairly normal life. However, I feel like I do have a platform, and I feel like a lot of people who follow me should go see the doctor more regularly, should get annual blood tests. I know my background is I was a college baseball coach for basically 10 years, and now I work privately. I run my own business. But I know a lot of college baseball coaches, and not just baseball coaches, but other people in general too. You feel healthy, you look healthy. I'll be the first to admit, if you just looked at me, again, not that I'm a professional bodybuilder or a physique model or anything like that, but I'm in pretty good shape. I look pretty healthy on the outside. I feel like there's a lot of other people who look healthy, feel healthy, and for that reason, they never go see a doctor. And the reason I bring up, baseball coaches, college, high school, wherever, is because a lot of people are always around or nearby an athletic trainer or a team doctor, and they've always got access to whatever information or medicine they may need without going through routine annual blood draws. So when I was a college coach, if I felt sick, if I felt myself getting a sinus infection, I would talk to our trainer or talk to the team doctor and say, hey, can you get me a Z-Pack? Yeah, sure, that's no problem. And I would get a Z-Pack written for me. But I didn't go to an annual checkup and get my blood drawn for a long time. And I know there's a lot of other people out there that don't do that as well. But like I said, I'm fortunate that I did go to my doctor. For the past number of years, I've gone every year just to have a routine checkup. And we caught this from an annual routine blood draw. So I guess the point of this message is it's not to feel sorry for me because, oh my gosh, Zan has this disorder and this is going on with him. It's hopefully there's someone that watches this video that says, man, I need to wake up. Like, look at Zan. Zan, I see his Instagram photos. I see what he posts on Twitter. He's constantly talking about good nutrition. He's constantly talking about working out, staying healthy, improving yourself, improving your body. And if this can happen to him, man, this could happen to me, or there could be some other issue going on that I don't know about. So I would challenge you and encourage you to, if you do not see your doctor regularly, I don't care what age you are, maybe you're a 25-year-old guy and you just finished playing college baseball and you feel like you're invincible and you feel like you're healthy, you need to go see the doctor. Okay, every single year, get your blood work drawn. Again, I told you earlier, I'm 39. I'm getting closer to 40 where, you start to see more health issues pop up. So even if you're 39 or you're 40 or you're 45 and you're not going and seeing a doctor because you feel like you're healthy and you look like you're healthy and you're at a healthy weight, there still could be things going on inside your body that you need to know about and you need to have checked out. So again, I feel fortunate. I don't feel sorry for myself. I'd be lying if I said there weren't a couple of days after I found out that I was throwing a pity party. That lasted about 2 days, and then I kicked myself in the ass and I got going again, and now I'm positive and I'm optimistic. But I do feel a little bit of responsibility because of the following I have, that I think I should share this with people, and I want people to understand that, you need to take care of yourself. Okay. I've not necessarily made any poor decisions. I don't smoke. I eat as healthy as anybody watching this, I bet. I don't really drink. A couple times a year on an anniversary or birthday, I'll have 1 or 2 glasses of bourbon. I don't drink much. I don't smoke. I'm not into other crazy stuff. I'm a pretty healthy guy, and we caught this. Okay. So I would just encourage you to take care of your health. If not for you, for someone you love. Maybe you're a husband and a father, and even though you feel good inside, you don't think anything's wrong. For their benefit, you need to make sure that you're healthy inside as well, not just your outwardly appearance. So again, I'm kind of going to cut this video a little bit short. I want to end it. If you've watched this far, I appreciate you listening. I appreciate you watching. And like I said, I don't want to be the face of this disorder. I don't want my life is going to continue to be normal. I continue to work out. I continue to spend time with my family. I'm going to keep coaching baseball. I'm not going to die anytime soon, at least. So everything is okay for the most part. I feel good. I'm optimistic. Doctors likes what he sees going on. The purpose of this video is not just to tell you that. The purpose of the video is to hopefully give you a wake-up call that if you're not going and seeing your doctor on a somewhat regular basis, if you're not getting blood work done, you absolutely need to, okay? Because again, this is something that it doesn't affect very many people, but maybe you find something else out that you have. So again, in closing, I know if you've watched this far, you're probably concerned, and you want to be empathetic, and you want to reach out, and you want to offer to do something for me. I promise you, there's nothing to do. I'm fine. I feel good. We're fighting this. Again, everything is going great. My doctor is unbelievably optimistic. I'm healthy. I'm the perfect candidate to have a long, healthy life after finding out about my PV diagnosis. So again, thank you, but there's really no need to reach out. If you want to leave a comment below, that's perfectly fine. Just being honest, I don't want to receive hundreds or thousands of text messages, hundreds or thousands of emails, people just to say, thank you, I'm thinking about you, I'm praying for you. While that means a lot, it would become burdensome to me to have my email inbox flooded, especially in the middle of a busy work time of year for me. I've got to concentrate on that. I want to spend time with my family. I don't necessarily want to spend time replying to a ton of emails. And then, I know I said in closing before, but one last thing that was on my mind that I wanted to think about. Over the past number of years, I've tried to be very intentional with how I spend my time. I get a lot of requests to speak at a baseball convention, to come work a camp here, to come have an appearance here, do an event over there, all over the country. I've been pretty intentional and fairly selfish about how I spend my time. I want to spend my time doing what I like with people I love, and doing things that I enjoy doing, and being around people that I want to be around. Okay. After you kind of find out that you've got a form of blood cancer, even though mine is not as serious as some others, I'm going to become more selfish with my time. I'm probably going to say no to even more things than I'm already saying, because I understand that your time is short, and I'm fortunate that I got lucky, so-called, and I have a very manageable form of this, but other people are not so lucky. There are people that you probably know that have a much worse form of cancer than I do, and their time here may be limited or may be cut short. And for those people, they want to spend their days and their time doing exactly what they want to do, and that's what I want. I want to spend my time doing exactly what I want to do with the people that I want to do it with. So again, I appreciate you watching. I appreciate your concern. If there's one takeaway, if you're a man, woman, child, brother, sister, husband, whatever, please go to the doctor. Okay. I promise you, I'm glad I did. I'm not necessarily glad that I have this, but I'm really glad we found out early and preemptively versus living 4, 5, 6, 10 years and then having a stroke and finding out in hindsight, oh yeah, that's why Zan had a stroke. He's had PV for the last 10 years. So I'm fortunate. I feel lucky. I'm optimistic. I'm happy. But I wanted to film a video and share this with you because I feel like it's important to share with you what's going on in my life. I've said it again, I apologize for rambling. It's just a lot on my mind. But I appreciate you watching the video. I know you probably want to reach out. No need, I promise you. I appreciate it, but you don't need to. But please, if I could ask you to do one thing, take care of your health, continue to eat healthy, work out, do the things you need to do to be healthy, look healthy, but also take care of your internal health as well. Okay, there's certain things going on inside your body that you just can't see from looking at someone. If you do have bad habits, alcohol, tobacco, other things, I'd encourage you to cut those out as well, because those are causing damage on the inside of your body that you can't see from the outwardly appearance, even if you feel okay and you look okay to the naked eye. So once again, thank you for watching. I appreciate it. I appreciate your thoughts. I appreciate your prayers. I appreciate your concern. We're doing great. Everything's fine. Optimistic. I feel good. And I just want to let you know what's going on. So thanks again, and I will talk to you again soon. And hopefully there are more videos in 2021 that are a little bit happier note. I'm going to get back to filming content regularly now that my life is starting to become a little bit more normal.